Hi there. This is my kick the coronavirus in the pants issue. We all know how many people are dying, 1,000 or so every day, all around the world from this virus. And it's about time we stirred up the pot a little bit and pointed out how, first, there is no cure for it. Our medical community says, yeah, we got to work on a vaccine. So it's incumbent on us to come up with something. And that's what I'm going to show you today in this video. Now, first, I'm going to tell you a little bit about myself. After I point out an article here, here's a Tribune article. Hot air from saunas, hair dryers won't prevent or treat COVID-19. Well, I'm going to get into this stuff, and I will say the amount of time you can spend in a sauna isn't enough time to kill COVID-19. But I'm going to talk about the fact that there are treatment, basically heat treatment, that will kill the cold, kill the virus, at least in the sinuses. So here's my resume. My name's James V. Bronke. I go by Jim. I live in Michigan. I retired, and my first job as a degreed engineer was at Litton Guidance and Control, working on inertial nav systems for howitzer guidance systems, midget man missiles, and military aircraft. I worked for the Naval Air Warfare Center at China Lake, worked on bomb design, radar system troubleshooting, etc., etc. Rockwell Collins, and Boeing, all these jobs. Boeing, on the Dreamliner, I was given responsibility to track and assure solutions for all the avionics problems in the development of the Dreamliner. And I personally managed over 6,000 problems in the 3 years I was there. And I was there when the first problem was submitted, and I was there when the last problem was closed out as being not needed to be resolved. I was also there in the first flight approval meeting, and stood up and gave an oath as to the safety of flight of avionics, with 16 other people there from all the different aspects of the aircraft. So what I'm used to doing is troubleshooting problems, mostly electronic. But of course, our body's a problem, and it requires research like anything else. So, when you got a cold, you research your body. So I want to point out, so I've researched some of the current treatments. If you let the coronavirus get out of hand, the latest video I saw said usually it starts out in the sinuses and then works its way into the lungs. Well, if it works its way into the lungs and you really succumb to it and have to go to the hospital and they put you on a ventilator, well, your chances aren't good. They say 20%. So the ventilators are almost worthless. And one of the reasons, the ventilator is just there to keep you alive. It feeds you oxygen, and it has to do it with 100% humidity so it doesn't burn your lungs. Well, what I'm going to show you is an alternative cure involves no humidity or very little humidity. The whole idea of actually curing you of a virus is to remove humidity. So this Neptune heated humidifier, which goes on the output of a ventilator in an ICU setting, is going to pump in humidity, and that alone is not going to help you. You don't want humidity because the virus likes it too. So nonetheless, I fought colds because I used to touch my face a lot. I was always getting sick. And I had contact lenses for many years. I would touch my eyes, not wash my hands. I'd get sick that way. So when I saw this article in the paper on this viralizer by Robert S. Krauser, I was dumbfounded. I bought one. And I won't read the whole article, but this is in, let me point it out. It's down here. This is Thursday, December 22nd, 1988. Okay, and what has been done to solve the issue of the common cold since then? Nothing. The coronavirus is a virus like a cold, and what do we get? Nothing. And what do our doctors do? They argue against something that actually does work a little bit. And I'm going to show you here the article. So right here, I won't read all the details, but here's something. But somebody forgot to tell Paul Daimler's nose about the controversy. The Stanford stockbroker says he's been plagued by miserable colds that linger for weeks. But in the year since he bought a viralizer, he's knocked out 3 colds within a day. So, and if you go a little further, right here, someone who's actually the director, Gabriel Letizia, director of AMA Laboratory Associates in New City, New York, where early testing was conducted. In one test with 24 cold patients, 87.5% of them said their cold symptoms were relieved within a few hours with up to 6 viralizer treatments. The results were more than remarkable. I'm surprised at how well the product works, she said. If that's a she, I believe. So they point out in here the up and downs of it, that sometimes it works for some, doesn't work for others, The bottom line is those are pretty strong statements that say something's been discovered here and it's worth following up on. I don't see that follow-up. Now, towards the end of the article, they point out here, studies didn't find any negative side effects. An entirely independent study conducted on 75 people without colds and designed to check for potential hazards to nasal functions, they found no damage from the use of the product like the viralizer. Okay, so here's something that a whole bunch of people said works, doesn't do any harm, and what do we get is arguments by doctors who say it doesn't work. Sorry, I believe I've got proof right here that it works. So I bought one of those viralizers, and here's the spec on the Neptune. This is the humidifier that's used whoops, wrong. Here is the humidifier that is used in our ICU with our ventilators. Puts out 100% humidity. So you will see in my discussion why you don't want to get that far. So Here is the patent from Krauser. He discusses decades of research with heat and colds. It's a patent number. You can see it, you can research it. I present this as just being evidence that there is some basis, a lot of basis, for, as a cure, that people look into this. So, and I'll throw this in there. This is all kind of random as I grab stuff. This is the Hippocratic Oath on Wikipedia. I would like doctors to remember this. I will not be ashamed to say I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. You know, for my work on colds, you can consider me to be a colleague. And anyone who's had a cold should be thought of the same way. Here is an actual picture of the viralizer that I took, and I'll show you mine. Now, what happened is I started using it, and I took it to an extreme level. I think where Krauser came up short is he just didn't study the use of it enough and come up with instructions that were no-nonsense instructions that he could stand behind. Now, if someone just used this viralizer for 5 minutes, or for, say, the amount of time you could sit in a sauna, you know, it wouldn't work. Not for me, anyways. I ended up learning, well, I had to take it to an extreme level, but I just breathed this thing constantly, maybe for an hour or two if my cold wasn't too bad. And when I had a really, really bad cold and I was in bed all day, I just laid there in bed with this on low and breathed the air all day. Now, I actually have it running now, and you can hardly even hear it. So it's fairly easy to watch TV and put this on your chest. I don't hold it out here like shown in the ad. I just lay it on my chest and breathe the air. It only uses 150 watts, and the nominal temperature is above 140 degrees F. And it's not enough to, like the study said, to damage you, hurt you. So probably the most important thing that I did in terms of understanding the use was after I realized that, well, it took quite a bit of time for it to be effective. Still, I had a question in my mind: what is causing the cure? What is the dynamic of the cure? So I did a test. You know, that's what us engineers do. We come up with a test. So what I did is I took a steamer and I put it on the input right here on the left side of this picture. I put a steamer there and put it up to my nose, as I usually did. So I was now breathing hot, steamy air at the same temperature, really. I'm sure that the steam coming out was close enough to the viralizer's temperature. So yeah, I figure it was about the same temperature. It was now steamy, hot air. It didn't work. I knew within a few hours it just didn't have the same effect. So I turned off the steam and drew the only conclusion one can draw, and that is the real solution here, the real dynamic and process is evaporation, not heat. And where Krauser made a mistake in his research is just that. He had never studied it enough to really learn that it was evaporation killing the virus. So that gives you a different perspective, because some may have a nose that just has more moisture in it. It might take longer, and some might be healthier, some might have a drier nose. Whatever it is, it doesn't take 5 minutes or 10 minutes to get the job done. And if you try a hair dryer, like some proponents suggest, well, it's just not going to work. Now, I do have a hair dryer here, and you turn it on, and it blows, even on low, it blows way more air at a hotter temperature than you need. You can still use it. You hold it further away from your body, make sure you don't burn yourself, but it's unpleasant. So that's why you need a viralizer. So I want to encourage people to search out this info. Now, I've had many colds, and I've been with many doctors in the course of the last 30 years. None of them have taken up the call to study colds based on my info. It was all, oh, okay, you got over pneumonia and you had to use your viralizer? Oh, okay. They never studied it or anything. We are doomed, if we have a capitalist system, to never get a problem solved if we don't have funding for research that is not profit oriented. Now, this little viralizer had some little spray things. I tried them, they didn't work. It came right down to just hot air for an extended period, and it killed the cold. And I did manage to get one friend who tried it, and it worked for her. So I know it works, but it is a hard sell, I'll say that. You have to be kind of desperate to want to try something like this. But I know it works, and I will argue with anyone who thinks it's nonsense. There was an article I had here, maybe I'll find it, but it's just that the one angle you have to know, if you're gonna, if you're in the news business and you're reporting on this, and doctors say one thing and you're wondering what the truth is, well, the answer is, how much research have you done? None of these doctors that believe this won't work have done any research. That's all you got to ask them. It won't cut it to claim you know something when you haven't researched it. So I probably killed 100 colds, and it's rare that I can get someone to try it, but at least they do. And so, and I'm just kind of winging it here. Can't find what I was wanting to find. So I'm just going to go back to my schedule here. I think what I'm going to do is, I'll have to so once again, getting back to the coronavirus, It first starts out in your sinuses, and that's where you got to hit it. You got to hit it with something like this. And I live here in Southwest Michigan. If you respond to this article with a thumbs up and like, and you say you need one of these, I'll do my best to get one to you for free, as long as you give it back to me, especially if you're a Green Party member. We have Green Party members around here that if someone out here in Southwest Michigan has the coronavirus, we will see if we can get one of these to you to borrow. We want to see you get over this. It's time to cure you. And it's time for our doctors to get on board with trying everything possible to cure a cold. The vaccines are too long in the making. So I'm going to let it go at that. Please comment below. Please try it. And if you need one, get a hold of me. Thank you. Goodbye.